So imagine a cancer treatment so incredibly precise, it's designed for just one person. Not for a type of cancer, but for your cancer, for your specific tumor. Today, we are unpacking a really revolutionary new approach that uses the same mRNA tech from the COVID vaccines to create these personalized shots that teach your own body, your immune system, to hunt and destroy cancer cells. All right, let's get into it.
And there's no better way to understand this than through someone who has actually lived it. This is Barbara Brigham. Her story is really at the heart of this incredible scientific leap. 4 years after getting her personalized vaccine, she's still here, still having those little adventures, and amazingly, still free of pancreatic cancer. In this image, well, it just perfectly illustrates the core idea, doesn't it? We're not talking about one vaccine for all melanoma patients or anything like that. No, we are talking about a unique formula, a totally bespoke medicine, crafted from the genetic code of one person's tumor. So every single one of these syringes represents a completely different treatment for a different person.
To really get the stakes here, you have to understand Barbara's diagnosis: pancreatic cancer. It's notoriously deadly. The 5-year survival rate is just 8%. But Barbara, she enrolled in this groundbreaking phase 1 clinical trial. Her tumor was removed, and then the real work started, creating her very own vaccine, her own shot to stop that cancer from ever coming back. So how on earth does this actually work? Well, to get it, we first have to understand the fundamental problem that cancer poses for our bodies. You see, cancer is a master of disguise, and this vaccine, it's designed to just rip that mask right off. Now, this table really breaks down the immune system's main job, telling the difference between self and not self. It knows to leave your healthy cells alone, right? But it's supposed to attack invaders like viruses. The problem is, cancer starts out as self. It's your own cells, just mutated. So it can often just fly under the radar, kind of tricking the immune system into thinking, hey, nothing to see here, move along. The key to unmasking the cancer lies with these things called neoantigens. Now, think of them like tiny, unique fingerprints that only show up on the surface of cancer cells. They're the direct result of the tumor's genetic mutations, and they are the exact targets we need to teach the immune system to go find.
Okay, so if these neoantigens are the fingerprints of the criminal, how do you create a wanted poster for them? And how do you distribute that poster to the immune system's police force, the T cells, so they know exactly who to hunt down?
Well, it's a pretty incredible high-tech process. First up, scientists sequence the DNA from both the tumor and the patient's healthy tissue. They do this to pinpoint the exact mutations that are unique to the cancer. Then, powerful AI algorithms get to work, predicting which of those neoantigens are most likely to kick off a really strong immune reaction. They pick the top candidates, up to 34 of them, and they encode their genetic instructions into one single mRNA molecule. And that mRNA is then used to manufacture the personalized vaccine.
All right, theory is one thing, but does this actually work in real patients? That is exactly what the Keynote 942 clinical trial was designed to find out. This is where we get the hard data, the proof of just how effective this whole approach can be.
So, this major study, which was published in The Lancet, focused on 157 patients with high-risk melanoma. Their tumors had already been surgically removed, and they were split into 2 groups. One group got a standard immunotherapy drug, which helps the immune system fight cancer. The other group, they got that same drug plus their own personalized mRNA vaccine.
And the results? They were striking. In the group that only got the standard therapy, 40% saw their cancer come back. But in the group that also got the personalized vaccine, get this, that number was almost cut in half. It dropped to just 22%. That is a huge, clinically meaningful difference.
And this right here, this is the headline number. The combination of the standard drug and the personalized vaccine reduced the risk of cancer returning or of death by 44% compared to the standard drug all by itself. I mean, that's just a powerful demonstration of what this vaccine can add to the fight.
And what's even more promising is that the benefit seems to get bigger over time. You can actually see the gap between the 2 groups widening. After 18 months, 79% of the vaccine patients were still cancer-free, compared to 62% in the other group. This suggests the vaccine isn't just some temporary boost. It's creating a durable, long-term immune memory against the cancer. It's teaching the body to remember the enemy.
So, the science works, which is amazing. But this brings us to a massive challenge. How in the world do you scale a process that is, by its very definition, completely unscalable?
Making a unique medicine for every single patient is an unbelievable logistical puzzle.
Let's just put this in perspective for a second. For COVID, manufacturers perfected a process to churn out billions of doses of the exact same formula. For these cancer vaccines, the challenge is the total opposite. It's about creating a batch of one, with a unique formula for every single patient, and doing it all in just a few weeks.
To solve this, companies like Moderna and BioNTech are literally re-engineering their whole manufacturing process from the ground up. They're using robotics to prepare sterile kits to minimize any human handling. They're deploying AI to manage the dozens of quality control tests needed for every single batch. And they're working to shrink processes like sterility testing from 2 weeks down to just 5 days. None of this is off the shelf. They're basically inventing the factory of the future.
So looking ahead, this fully personalized approach isn't the only game in town. Researchers are now exploring a whole spectrum of strategies, which could open up 3 really different paths for the future of cancer vaccines.
On one end of the spectrum, you've got the fully personalized vaccine we've been talking about. Maximum potential benefit, but also, maximum cost and complexity. In the middle, there's a warehouse model, where a vaccine is assembled for a patient from a pre-made library of common cancer antigens. That makes it faster and cheaper. And then on the other end, you have an off-the-shelf approach, a single vaccine designed to target common features of a specific cancer, kind of a one-for-many strategy.
And the applications could go even further. What if you could give a vaccine before surgery to shrink a tumor, make it easier to remove? Or, and this is the holy grail, could you one day give a preventative shot to people at super high risk to stop cancer from ever even forming? These are the huge questions that are driving the next wave of this research. But for all this incredible scientific promise to become a reality for patients, the scientific and logistical hurdles, they aren't the only ones we have to overcome. In fact, the biggest challenges might actually be societal and political.
Now, to really highlight this challenge, one of our sources, Scientific American, published this speculative article that imagines a pretty concerning future. Writing from the perspective of November 2025, it raises the alarm about potential political shifts leading to massive cuts in federal research funding, the very kind of funding that supported this science for decades.
The article points to a potential future where the success of mRNA technology in fighting COVID has paradoxically made it a target. And this scrutiny could endanger not just our ability to fight the next pandemic, but this entire field of cancer immunotherapy that is just now beginning to unleash its power. And that is what is truly at stake. A treatment like the one Barbara Bregan received wasn't just created in a vacuum overnight. It was the result of a deeply collective enterprise. It's built on decades of taxpayer-funded research, on thousands of tissue samples from patients who came before her, and on the tireless work of generations of scientists.
So, we're left with this huge question. We have a technology that could genuinely redefine our fight against one of humanity's oldest enemies. We have the science, and we're cracking the logistics. But what is it going to take as a society to make sure we actually realize its life-saving promise? That is the real challenge that lies ahead of us.